can get going. I think, there we go.
There we go.
All right, I still see folks coming in, but we'll go ahead in an effort to recognize that everybody's time is very valuable. We'll go ahead and get started today. I'm Christina Phillips, and I'm one of the Provider Network Development Supervisors here at Alliance, and been working on this waiver. It's been a labor of love for many years now. I started with the team back in 2017 when the waiver was ready and being prepped for launch. We launched the waiver in 2018 and have been live now for over 3 years. Very excited to see this waiver extend into our newly aligned catchment area. We've got Orange and Mecklenburg County now as part of our catchment. And we are anticipating that CMS will approve extension into Orange and Mecklenburg counties, most likely late summer, early fall is what we're looking at right now. And so this is really kind of our prep session. It's our first time reaching out to providers, getting some interest going. Really excited to see this waiver extend out to additional counties. So that's where things stand right now. Again, I'm Christina Phillips, and I will let Melissa introduce herself as well.
Good morning, everyone. My name is Melissa Hall, and I am a development specialist here at Alliance. I am on the TBI Waiver team, and I'm working closely with Christina as well as some of our other internal partners and external partners here to get this waiver up and running and out into Mecklenburg and Orange counties. So welcome.
Excellent. I do see some of our team members are actually on right now. So I am going to say a quick hello to Dr. Subcheck. Dr. Subcheck is actually is our IDD TBI clinical director. She's come to us from Cardinal. And I just wanted, Dr. Subcheck, if you want to say hello, I know you're an integral part of our team.
And you're on mute, Dr. Subcheck.
I don't know. I can't see myself. Let's say hello.
I recognize that was a bit of a surprise for us to get you on. But
No. I was just trying to figure out some, and I can't see myself, which is weird. But just wanted to say hello and welcome. And if you have any other questions, and I'll do what I can to address your concerns.
Excellent, thank you. We also have, I believe, a few of our state partners on, just for folks to know that we do work very closely with DMH and DHB on a regular basis. They are partners with us to roll out this waiver. So I believe we have a few of our partners on as well right now. So thank you for attending. It looks like a great turnout today. I do want to remind folks that we have the same presentation has already been done earlier in June. So if you did attend that one, it's not going to look much different. We are presenting the exact same information. We recognize that Mecklenburg County is very large, and we wanted to have a chance to be able to present to as many potential providers as possible. So with that, we can get going.
All right.
All right. So thank you for being with us today. What we're hoping to cover is what is traumatic brain injury. Several folks, of course, at the table are very familiar with it. And for some individuals, this may be a new population. We're also going to go over the TBI waiver and the array of services that individuals receive when they're on this waiver. We're going to talk a little bit about member rehabilitation versus habilitation. And one thing we want folks to take away from this presentation is that this waiver is for adults and is a rehabilitative waiver, trying to regain skills lost. So that is a really important part that we want to hit home when we're talking with providers. That's one thing we will be asking is, what is your rehabilitative approach? Also, provider training and supports. If you are new to supporting the adult TBI population, or even if you've had several years and you want your direct support staff to get additional information, we want to make sure you get connected to the Brain Injury Association of North Carolina. They have been a strong partner with us from the beginning, so we will go over some of what they have to offer as well.
All right. So let's talk a little bit about our catchment areas and the TBI waiver counties. So as you see in this grid, the catchment area for Alliance is Cumberland, Durham, Johnston, Wake, Orange, and Mecklenburg. Currently, the TBI waiver is in the 4 original catchment counties for Alliance, which would be Cumberland, Durham, Johnston, Wake, and Orange. As Christina mentioned a little bit earlier at the beginning of the presentation, we are hoping to get the approval for the expansion into Orange and Mecklenburg late summer, early fall at the very latest. And just a little bit more about Alliance, that we are currently offering a network of providers who offer treatment and support for mental illness, substance use disorders, intellectual and developmental disabilities, and now the TBI waiver. So again, with Alliance, the population that we work with would be those who are uninsured, underinsured, and of course, those who are Medicaid recipients. So I do have a poll that I'm going to put up, and this is the poll question. You can definitely click yes or no once it comes up here. Let's see if I can get this to launch. All right, and we'll give y'all a few moments and you all just click yes or no. Can you all see that? I want to make sure it's okay. Awesome. And the question again is, has your agency supported 5 or more adults with a traumatic brain injury in the past year? You can click yes or no. And just to put this out there as you all are answering, this question is certainly not a way to exclude any providers or to say, oh, you all cannot potentially offer the waiver if you're interested or certain services within the waiver. It's just trying to give us an understanding or a better picture of who's coming into your agencies, what population is asking for services, and if there are a lot of folks with a TBI who are coming into your agency seeking support and services. All right, so we'll go ahead one more second and we'll end the poll here. All right, so it looks like it's almost half and half. We have about 55%, and I'll share the results here, who said yes, and then 45% of folks who have not had 5 or more. So that's actually really telling that there certainly is a need for TBI waiver services, especially in the Mecklenburg and Orange area. All right, so let me...
Right. So I think knowing that some people have, of course, worked with adults with traumatic brain injury, this is a newer population in terms of being covered by a Medicaid C waiver, right? We've had innovations for years, and having an adult C waiver is fairly new to North Carolina. It is the first. Other states have them, such as New Mexico, Colorado, but this is the first time here in North Carolina to have the C waiver. And again, it's been piloted in our 4-county catchment area. So just for folks to really kind of understand, who is this waiver for? Traumatic brain injury. So the adult must have sustained, and we'll go over this a little bit later too, but must have sustained their injury on their 18th birthday or later. So that's something really important to keep in mind. The age was actually recently changed from age 22 and older. And that was due to a lot of feedback from our medical team to the state, where Dr. Casemeyer and several different team members said, we really want to see this waiver being served, more people being served by this waiver. So the age has been changed, and we're very excited that now we can serve a broader array of individuals who are now experience their injury 18 and over. But again, to obtain services for this waiver, one of the first things we look at is there truly a TBI? And that is an alteration in brain functioning caused by external forces. And so it's really important to think through, because it does not cover strokes, anoxia, overdoses. It is external force, blunt force to the head. And that will go over some of the causes of TBI. But again, you're thinking through external forces to the head, direct impact. Now, other things can also cause a TBI, such as inertial forces, and that could include something like shaken baby syndrome. But for somebody who comes to us that says, they were diagnosed with shaken baby syndrome, unfortunately, because that injury was sustained at birth or around that time period, early on, that they would not be covered under the adult TBI waiver. So just wanted to clarify that. I think there were some questions last time on who that, if that was something that would be covered. So no, the injury must be sustained on their 18th birthday or later and be external force, direct impact to the head. All right, what are some of the top causes? I think some folks are very familiar with this data, but we're seeing that falls, the CDC is reporting that falls are the #1 cause of brain injury, followed by car accidents, firearms, and oftentimes you're looking at domestic violence situations where abuse survivors will not come forward. That is really hard to diagnose sometimes, and they often will not self-report or go to the emergency room after being the victim of abuse. And so oftentimes you're seeing that folks are not reporting it, it's going undiagnosed. So that is just something to keep in mind when you're talking to abuse survivors. Have they had blunt force trauma to the head? We're also seeing that the elderly are one of the highest incident levels of falls, and therefore often sustain TBIs. And often once somebody has sustained a TBI, they are at higher risk for sustaining a secondary TBI. So that's just something to keep in mind. But again, TBI, traumatic brain injury, can happen from various different reasons and causes. And hopefully this slide helps explain some of the top causes of TBI.
All right. The next slide that we have here is what's called the iceberg theory. So when you look at this slide, you see the top of the iceberg. And then, of course, once you go below the water level, you're seeing just a huge chunk of the iceberg just underneath. So what that wants you to look at or think about, or what it's portraying, would be a lot of times what we see whenever we are working with someone who may be diagnosed with a TBI. They may look just a certain way, like everything is fine, they're not having any issues, they're quote unquote normal, and things are just going as they should. They're living their lives every day like we might be. But one thing to think about are all the things that might come as a result of having a TBI. So things like fatigue, headache, memory problems, issues with sleeping, or some sort of disturbance with sleeping, loss of motor skills. And these may be things that either someone with a TBI may not even relay to either a DSP that might be working with them, or any support system that may be working with them. Or they might know what's happening, or they might say, yeah, I do have headaches, but may not understand that it could be a factor of a TBI that they have sustained. So we wanted to put this in there to make sure that whenever you're thinking about working with a member who might have a TBI, that especially for staff who may be working closely with them, they understand that there are a lot of underlying issues that come as a result of that, so that if it's mentioned to them, they can certainly help out with getting the person linked with supports, or they could ask the person, hey, have you been experiencing any of these things, just to make sure that we can support these folks who have a TBI as best as we can. So just, keep that, this iceberg theory in mind, just because it's really important to think, just because someone looks like they're doing fine just every day, doesn't mean that they're not dealing with a bunch of other things that could be a result of a TBI.
All right, so I know some folks are aware of this, how long it took to get the NC TBI, adult TBI waiver here to North Carolina. It was definitely through lots and lots of years of advocacy, over 20 plus years of advocacy brought this waiver here. The Brain Injury Association of North Carolina, the Brain Injury Advisory Council, which is a state level committee, TBI community advocates, families, survivors, all came together. And in 2016, the NC General Assembly approved funding for the TBI waiver pilot project. We did go live in May of 2018 with CMS approval, of course, and we are now in the stages of kind of ending the pilot here in Wake, Durham, and Johnston, meaning that it's now been renewed for another 5 years, which is great, and then starting to bring that waiver out to Orange and Mecklenburg counties. Again, that needs CMS approval to do so. But we are really, we piloted it strongly for 3.5+ years. And now at this point, the waiver has been renewed for another 5 years. So we're very excited to see that happen. And again, just want really folks to hit home that this is a rehabilitative waiver. It is not a habilitative waiver, it is rehabilitation. So the idea is that it allows individuals to live in their homes of their choice, have employment, or engage in a day of their choice. And Melissa, I'll turn it over to you to go a little bit more in detail about what this waiver covers.
All right. So who is the North Carolina TBI waiver for? So as mentioned, it is currently in our existing or our original 4 counties. So that would be Wake, Durham, Johnston, and Cumberland counties. We are again set to expand as long as we get, and we are not even as long, we are hoping to get CMS approval, and the expansion should take place late summer, early fall into Orange and Mecklenburg County. So again, the TBI waiver is an adult-only waiver. It was initially 22 years of age and older with the age of injury, but thankfully that has changed upon the renewal, which took place April 1st of this year. So now the age of injury is 18 years of age and older. And so with the help of our medical team, as well as our partners with the state, CMS did approve that additional change. And I want to go to this next slide where it does talk a little bit about the types of eligibility. So when we're thinking about the TBI waiver, of course, this is a Medicaid service. So the financial piece is that members must qualify for Medicaid, and then of course, understand what comes with those qualifications for Medicaid. The good thing is the financial eligibility has been expanded to 300% with this waiver renewal. So really, I believe that is probably the highest financial percentage for at the poverty level. So 300% of the poverty level, which really gives a greater population of folks who can take advantage of this waiver, who may not otherwise have been able to get Medicaid at all, and let alone take advantage of any particular federally funded or state funded waiver. So with that 300%, it really does cover a vast array of folks in different and all types, all walks of life. So that's really a big deal. So it's not just folks who typically get Medicaid, it's just a wide array of folks who can get this service if needed. Also, the diagnostic eligibility. So you must have sustained the traumatic brain injury on or after your 18th birthday. And the level of care, you must meet the level of care typically seen in a skilled nursing and or an acute rehab setting. All right, so let's talk about what's not covered. I know Christina mentioned a little bit about this. So what's not covered would be a non-traumatic brain injury, and some people refer to that as an acquired brain injury. So those are things like if a stroke, the lack of oxygen, if you have an overdose. So if you're thinking about what's not covered, it's usually things that are not a result of a direct hit to the head. So when you're thinking about sports, like football and things like that, that have those high impact sports, those things would be covered. But if someone did have a drug overdose, or unfortunately they did have a stroke, those would be considered non-traumatic. So at this time, it would not be covered by this particular waiver. Now, there are some talks going on to see if perhaps maybe that can change in the future. But just at this point, currently, it is just traumatic brain injury or that direct impact that will be covered under the waiver. All right, Christina.
All right. So we're going to go over just a little bit, and we are going to be sending out this slide deck after the presentation so your teams can review it together. So we're not going to go into a high level of detail in terms of, or kind of get into the weeds with all the different services. Some of the services will look familiar, of course, because they look similar to Innovation's waiver services. Some services are probably be brand new to you, cognitive rehab, things like that. Those are kind of our flagship services here on the TBI waiver. So I'm going to go ahead and turn it over to Melissa, but this is really going to look at the services and unpack them a little bit so folks can understand what is going to be provided and what kind of services we're looking for providers to help partner with us to provide to our members.
All right, so our array of services, and I'll go over the list very quickly here. So our array of services would be cog rehab, supported living, life skills training, day supports, residential supports, respite, crisis services, community networking, resource facilitation, which will be going away once the Taylor plan hits. So that's why we have that asterisk there. Remote supports, supported employment, natural supports education, specialized consultative services. And I'm going to stop there very quickly. Well, actually, let me keep going and I'm going to come back to the SCS services. Personal care, speech OT, PT, which does have payer of last resort, and then community networking. So I wanted to touch very quickly on the speech, OT and PT, and then also kind of correlate that to specialized consultative services. So with the speech OT and PT, one thing to keep in mind, so if there are providers up here who offer those services, just keep in mind that with this waiver, it is a payer of last resort. So typically, if someone needs a speech OT and PT, they would have to go through their primary payer first. And I believe it might be 27 or 28 sessions that they would have to complete before they would be approved to then have those particular services pay out through Medicaid C and the TBI waiver. But if you do offer those, you certainly can look at specialized consultative services. We certainly need providers to offer like consultation when it comes to our members with TBI. So if you typically do speech, OT, and PT, if you're interested in the TBI waiver, you can certainly ask about and have conversations about adding that service to your contract once it's in Mecklenburg and Orange. But just keep in mind, it's not a very high referral source. You really have to go through the primary payer first. And usually it's very rare that it gets all the way back to the TBI waiver to start paying out. So the specialized consultative services may be your best bet, and maybe having that as a secondary service. Also, our supported living, we actually just are getting that going in our 4 original catchment counties. We have 3 providers who are offering those services. So as you all are looking at this list, and I'm going to kind of go very quickly through the next few slides, it has the service as well as the description listed on the slides as we move forward. Once we send this out to the group, please make sure that you take a look at the slide again, but particularly slides, I want to say it may be 18 through 22, because it really goes in greater detail about each of these services and gives you a really good description. That way you can talk with your leadership there, also even speak with the direct support professionals that you have on staff to see who might have experience working with someone with a TBI, just to get a good gauge of if this is a waiver that you'd like to participate in, kind of where you are staffing wise and who may have experience doing what. So this is a list of the services. These next slides here, as you see, it has the service as well as the description for each of those services listed. So once you do get a copy of this slide deck, you can go back and look at each of those services. And we'll also make sure that we include the CMS approved waiver, which also goes into greater detail about each of the service definitions. All right, Christina.
All right, so some of the folks on the call right now might be, of course, our providers, but may have members that are interested actually in the waiver. And so we did want to touch on that briefly, how to call in, how do you access the waiver. Right now, there are still slots available in our 4 county catchment areas. So that's Wake, Durham, Johnston, and Cumberland. If you know of a member that is in that local area or in that catchment area, that part of our catchment area, please have them call in. They can call our 1-800-ACCESS line and be placed on what we call our registry of interest. It is not a run, not a registry of unmet needs. It is a registry of interest. They call our access line. Please specifically let folks know that you are calling in about the TBI waiver or TBI services in general to see what they might be eligible for. So just for folks to know here, this slide is actually kind of forward facing. This is more looking at tailored plan. Our access numbers will be changing here shortly as we get closer to tailored plan, most likely this fall. For right now, that 1-800 number at the top, 1-800-510-9132 is the number to call to ask about TBI waiver services. From there, they will get a brief TBI Ohio screening. And then they will be passed along to somebody who will ask further questions about the traumatic brain injury, how it occurred, and what kind of diagnostic information they have. One of the things you can help members to do right now, if you know of somebody who is from our 4 county original catchment area and is interested in the waiver, please have them start collecting their documentation. And that can be diagnostic reports, psychological evals, any proof of their traumatic brain injury and the accident that occurred. That is some of the hardest pieces of information to find sometimes. It is often buried in medical documents. We found, for example, one hospital had thrown away the records from an accident that had occurred 20 years ago. So again, really difficult sometimes to find. Please know that they will receive some support in trying to get those documents if they do not have them. In terms of families in Orange and Mecklenburg County, they can actually call in right now and still be placed on our registry of interest. So please encourage those family members to call in. They will receive, once we go live in Orange and Mecklenburg, and we'll be sure to announce that through provider news. It will be on our website. Once we're live in Orange and Mecklenburg, they will receive outreach from our clinical teams in the form of what we call a TBI guide. and that guide will reach out to help them secure the documentation that they need to go through eligibility. All right. So we do have a TBI webpage set up. Of course, you'll get a copy of this. If you do not receive a copy, I'd say by in the next 3 to 4 business days, please alert Melissa or I, or we can put our emails. Melissa, if you don't mind, we can pop the TBI communications. Oh, I think it's going to be on our slideshow. You can email TBI communications email address, which we'll have at the end of the slideshow if you don't get a copy of the slide deck. So if you're interested in learning more, please go to that website that's listed on that last slide there. We do want folks to be able to share information about the TBI waiver, not only with their teams internally, but also with members who might be interested in applying to be a part of the TBI waiver. All right. So hopefully that answered some basic questions about what is a TBI waiver, who is it for, what are the services we're looking for providers to assist us with. We are looking at probably around, like we said, late summer, early fall, where we'll be announcing that people or providers can submit their provider application requests. We are encouraging providers to email us we'll have an email address at the very end of this slide deck to reach out to us, talk to Melissa and I about what you're interested in. What is your agency really wanting to provide? What is your experience? Just start the conversation with us. But one of the things we did want to hit home is that the Brain Injury Association of North Carolina is a great partner for your provider agency. If you're truly interested in providing traumatic brain injury supports, you want to make that connection with Beyonc. And so their website is right there. They have amazing trainings. If you go onto their website, they have actually a learning institute. They've got all kinds of webinars. They've also got great support groups across North Carolina. So one of the things you really want to be thinking through is, how am I going to train my direct support staff? Most staff are coming in with developmental disability histories, or working with the disability population, not necessarily with the adult TBI population. And it's a very different population to serve. So thinking about how you're going to be training your staff to prep for this is really important.
All right, so let's talk about the timeline. Like, where are we? What is pending? What's coming up? So currently where we are initiating provider engagement, which we're doing that through these provider listening sessions. And then of course, if you all are interested and you send information to our TBI email address, either myself or Christina will follow back up with you. It's almost like a vetting process, just to get more information, to talk to you about the experience, what you're interested in, and all of those things, just to get you prepped and ready. And also just thinking about the TBI waiver in general. So that is currently what we're doing. Also, we will be sending out communications as we learn more information, as we hear back from the state and CMS about the approval into Meck and Orange. We'll be sending communication out about that. So the things that need to take place before we can actually go live and get the ball rolling in Meck and Orange. So our partners with the state will be requesting to CMS the approval into Orange and Mecklenburg to add the TBI waiver. Once they do that, they will mull it over, they'll review, and hopefully it'll come back with an approval. And once that happens, then Alliance, we would open up the network in Orange and Mecklenburg County for those who are interested in offering TBI waiver services. So these 3 here are pending, but I'm sorry, I don't know, I heard something, but these 3 here are pending. And so once we get more information about those things, then we'll certainly relay that information to you all. So we'll talk about some next steps. So the first thing would be to review the Centers of Medicare and Medicaid, the CMS TBI approved waiver. So when I send out the slide deck, I will make sure that I include that CMS approved waiver, but it is also listed here. So on this slide deck, all of these links are active links. You can click on all of them and it will take you to the websites and the web pages where these things are housed and located. So actually, I may not attach it, being that the link is right here, but here's the link for the CMS approved waiver. Also, to monitor our provider news. So if you are not already signed up with Alliance's provider news, that I believe comes out weekly, we are urging you to sign up for that. And it's not just specific to the TBI waiver. It really just is great information for our providers to learn about the different things that are coming down from the state that we are informing you all about different things that are happening in Alliance. So if you are a provider and you have not already signed up to receive those weekly news blasts, please make sure you can click this link here and it will take you to the sign up for our provider news there. Also, the next step would be to review this PowerPoint. So again, as mentioned, I believe it's slides 18 through 22 that really talks about the services and gives a description of each of the services that are on the waiver. So that, coupled with the CMS approved waiver that goes into greater detail, it's really a good idea and our suggestion to review those things just to familiarize yourself with the services and also to review with your direct support staff to see if, hey, who is interested, who may have experience, has anyone worked with the adult TBI population in the past, just to get a better gauge of whether or not this may be a good service or a good fit for your agency. Also, as Christina mentioned, when it's talking about beyond Alliance, it's acquainting your agency with training, supports, and services offered by the Brain Injury Association of North Carolina. So they have really great trainings, modules, webinars, all types of things. Like, they really are a wealth of information. So if you are truly interested in becoming a TBI waiver provider or adding these services to your contract, definitely reach out to Beyond. Definitely take a look at their website and see all of the things that they offer. That way you can better prepare yourselves and your staff for just working with the adult TBI population. And then, of course, just as mentioned, just begin assessing staff training needs. It's good to just be prepared. As I hear people say sometimes it's better to stay ready so you don't have to get ready. So it's really good that if you can have a conversation with your direct support staff, really see who may already have some experience, and then just see if they don't, what training needs are there so you can do those trainings and get everyone on the same page. That would be great as well. So we're coming to the end of our presentation. So our next thing would be to thank you all for your time. Thank you all for joining us this morning for this TBI waiver presentation. Please, at this time, if you have any questions, certainly shoot them in the chat, or you can unmute yourselves and ask questions. Myself or Christina will definitely do our best to answer. And we do have Dr. Subject, not to put you on the spot, Dr. Subject, but on our clinical side, if you have some questions there, she may be able to answer those questions as well. So thank you again. Oh, and this email here, this is where you would send information. If you have interest in the TBI waiver and just interested in certain services, you can shoot us an email at this address here, and myself or Christina will make sure that we respond and answer back.
Yeah, and Melissa, I'll add that email address is really created for providers, not necessarily members interested in the waiver. We really want to make that delineation. That email address is for providers who want to learn more about the waiver, have questions, want to show interest. Again, it's a way to connect directly with provider networks here at Alliance.
Yes, correct.
I have a question. I have an individual that I support on my caseload who sustained a brain injury at a very early age. I believe he was 11 when it occurred. He is currently enrolled in the Innovations waiver. So I'm just kind of curious to know if you can highlight the differences between the two waiver programs as far as what's being offered, being that it seems like he will not qualify for this TBI waiver since his injury was sustained at an early age.
Sure, and I'll let Dr. Subject too jump in here as well, because that sounds like a clinical question as well. But I can say very clearly this is a rehabilitative waiver. So when we talk about that, it's the focus and emphasis for all the direct support staff should be, and the teams working with the members, is to be helping the member to regain skills lost. We do have flagship services like COG Rehab, and that is a service that is not on Innovations waiver. But Dr. Subject, I'll let you kind of expand a little bit on that. It is a very different waiver. And we want to make sure that's clear that it's a different waiver than Innovations.
Yeah, I mean, I think to piggyback on what you're saying, Christina, that's in my mind, one of the biggest differences is that access to cognitive rehabilitation. It's not that it's not out there, but I think it has been very difficult for people to access, particularly who have Medicaid. Often it is private insurance that is the payer for a lot of those folks. So it's so the idea is that people have better access to that cognitive rehabilitation. As Christina said, this is a rehabilitative service for people who have lost skills as a result of a traumatic brain injury, but also teaches compensatory strategies, which is an important component of cog rehab, which is basically, you want to help people learn what they lost, but the nature of brain injury is such, yes, the brain is elastic and has really amazing abilities to kind of find workarounds on its own, but the compensatory strategies also help support that process. So I always think of like Memento, right? So right now, this is a snapshot of where I'm functioning right now. You can try to, work on relearn those skills, but sometimes there's just a hole where the ability to, to do a certain task or to learn something, it's you just don't have it right now. So it's basically teaching people workarounds around those places where right now you're just, I can't remember names. I'm having a lot of difficulty organizing myself, or remembering where I need to be next, or what I did yesterday, or, organizing myself, or staying on task and focus. So it's those kind of additional strategies that's it's not that they aren't things that could be useful for people who have an intellectual disability as well, but they're kind of targeted for that. There's an assessment piece too of that person with the brain injury, what their particular kind of like a Swiss cheesy, where those holes are, and determining what strategies would be appropriate for them based on where their particular challenges and limitations are.
And Dr. Subcheck, I'll add that, when I think through specialized case consultation providers that we have on board right now, we really are vetting those providers and asking questions such as, do you have 500 hours? And that's about a year of working with the adult TBI population, right? So we really want them to come in, if you're an SCS provider, so you're coming in as an OT, PT, or speech therapist onto the TBI waiver versus innovations. We want you to have that experience with the adult TBI population. So when you come in, it's a rehabilitative focus that our OT, PT, and speech therapists who are providing SCS, specialized case consultation, come with.
And I guess, following up with that, so the other difference would be all the various people who are involved in your care will have the specialized training with respect to the TBI population. So it's not just cog rehab, but your supported employment provider, your the supported living, and all the various services. The difference would be there's specialized training for whatever provider you're going to come in contact with, who's going to have some knowledge at differing levels depending on what the service is about what we were talking about with respect to that cog rehab component.
Thank you. And just a quick follow-up question to that. Is there any motion, or do you guys have any idea if they will eventually open this up to individuals who sustained brain injuries at an earlier age?
It's not something I'm familiar with. Did anybody else heard about that?
I think so what this adult TBI waiver is based after, and Dr. Subject and I have kind of looked at this, is the adult definition the state has for adult TBI. It actually states age 22 in the state definition. We were able, CMS approved it in North Carolina to be changed to 18. I don't see it going younger than that because you're talking about, was it sustained after the developmental years? So I can't say it won't, but I don't see it happening going lower than 18, which I think 18 was actually very exciting for us to see that, because it did open doors to more people.
Okay. Thank you.
So, yeah, what I would hope would happen is at some point we figure out a pathway to provide these kind of specialized services for folks on an innovation waiver who did sustain a
Absolutely.
But I can't say that that's happened, but that's just what's in my head.
Well, that's what I was
It would be great.
I was going to follow up and say, it would be great if it seems like there are some really great resources that the individual that I'm supporting would be benefiting from
Absolutely.
if he could add that to his current waiver services. But it doesn't sound like that's an immediate thing. So, but I appreciate it.
But you certainly could also, even beyond the waiver, connect with the Brain Injury Association, get the family involved there, have them connect with some of the support groups, go to some of the trainings. They have a summer camp that is just specifically for young children, adults for that have traumatic brain injury. So there's lots of different resources we can connect you with too.
Okay, great.
All right, I don't see anything in the chat. So folks, if you do have questions and maybe you don't want to unmute, you can certainly pop it in the chat and we can answer it that way. We don't want to put anyone on the spot. So certainly there are several ways to do so.
Yeah, and I think if we don't get any additional questions, Melissa, we'll go ahead and make sure we check that TBI info at alliancehealthplan.org. That is directly connected to provider networks for the TBI waiver. We'll be sure to check that often. We really appreciate everybody's interest in coming to the table. We've had a great success with our now 3 listening sessions. We had 2 for Mecklenburg County and also 1 for Orange. So more information will be coming out regarding this waiver. Please keep an eye out on provider news. And Dr. Subject, that was very kind of you. You placed your email address in the chat. So that's great. People can consult with you and ask questions. Yeah, and just for folks to know, Melissa and I are here. We're ready to listen. We want to hear what services your provider agency is potentially interested in providing.
Absolutely. So if there are no more questions, kind of going once, twice, and 3 times, we definitely thank you all for jumping on this morning and joining us. We really do appreciate it. We are super excited for this waiver to be coming to Meck and Orange County. So again, make sure that you're signed up for the provider news. And then of course, if you have any questions, any interest, anything, please send us an email at tbiinfo@alliancehealthplan.org. So again, thank you all so much. And I hope you have a wonderful rest of your Thursday.
Thank you.
Thank you. Bye-bye.